we're using insurance wrong. A wrench makes a decent hammer, a hammer makes a horrible wrench. So we need a better model for primary care. And in this sense, it is an insurance-free model that charges patients a monthly membership like a gym or like Netflix or Amazon Prime for a broad range of access and is based on age only. So for our patients, it's $10 a month for children, 50, 75, or $100 a month for adults, just based on their age ranges. And those are the prices we started at with 2010, and we've been able to hold on to those, right? What insurance company has been, been able to go a year without raising their prices? But in exchange for that, we wanted to offer as much value as we could. So the membership provides unlimited home visits, work visits, office visits, phone calls, text messages, emails, video chat. But also, we've been able to eliminate copays. Copays are a speed bump that the insurance, requires so that patients have to spend a little bit of their own money before they spend a lot of the insurance company's money. We don't need it as a business model, right? And no more than a gym needs a copay to try to keep people from coming into the door. And so we love that aspect of it because it hits those, quadruple lanes, more care, more often, faster, easier, et cetera. But then continue to add that value. Any procedure we can do in the office is free. Stitches, biopsies, joint injections, ultrasound, although we're not as good at it as we could be. I see the residents coming out of training, they are so much more used to that than how we trained. We have DEXA for bone density screening, body composition, et cetera, Holter monitor. And because, those procedures are all essentially extremely low cost. An EKG costs maybe 40 cents. The coffee in the waiting room costs 80 cents a cup. So if I don't bill your insurance for one, why am I doing it for the other? I just don't need to anymore. And I'd rather not have the frustration than the revenue. But it keeps going. And I feel like that's the beauty of the direct care model is it tries to touch more than people expect primary care to do. We can do wholesale meds and wholesale labs. We're about 80% cheaper than Amazon, 70% cheaper than GoodRx, and about 40% cheaper than Mark Cuban. There's not a billionaire alive who can get meds cheaper than a direct care doctor. And if you go direct with the labs, CBC is $2, TSH 250, A1C 3, lipid 350, right? The goal of direct care is to make most healthcare too cheap to insure and be able to get all that for $50 a month is a huge step in the right direction for putting patients first in order to fix healthcare.